Now, while efforts to find a cure remain a priority all over the world, the numbers keep rising by the day. At the last check, cases have exceeded 10 million from 213 countries and territories. Now, more than 500,000 deaths is so far recorded in about 6 months of the pandemic. More than 5 million patients have recovered. Now, in Africa, the death rate is in excess of 9,000 out of a little less than 400,000 cases. On the continent, more than 180,000 recoveries have been recorded so far on the continent. Joining me now via Skype from Denmark is Professor Ade Ojeniyi, the Chief Physician and Professor of Human and Veterinary Medicine. It's nice to have you join me, Professor Ojeniyi. Now, as it is right now, the COVID-19 pandemic is turning out to be the worst pandemic in human history. But as it is, with all of the sophistication and knowledge and the signs that are at the disposal of experts, I wonder how up until now that there hasn't been any headway. Every effort is still experimental in nature. Why is it so?
Well, thank you very much. It's a pleasure for me to be back. Thanks so much for your efforts. Now, why is this the case? Well, this is simply because we don't have much experience on this particular coronavirus. You know, there are many other coronaviruses. Influenza virus is one of them. SARS is one of them. MERS is one of them. Ebola is one of them. This one is a new one, and so we've not been able to accumulate enough knowledge. There's still a lot we don't know about this virus, and therefore, the best option we have at the moment is prevention. And as you can see me with this mask, that is the key. Then social distancing, if it is possible, is another. And of course, hygiene is a third.
All right, as it is now, governments are doing everything they can, but what more can be done? WHO is saying that the worst days are still ahead. Ministries of health across countries are saying the worst days are still ahead. What more can be done that hasn't been done yet?
Well, there isn't much more that can be done. What has been done has to be intensified. A new lockdown is not excluded at all. If we are to contain this virus and the spread, all we can do is to curb the spread of the virus. And the most effective ways of doing this is preventing dissemination of the viral particles. And that's where the mask is of extreme importance. Then social distancing. But again, if you have such congested area limited inclusion of people where you have hundreds or thousands, even in marketplaces, it's not only inside buildings. Marketplaces are just as congested. So social distancing can be quite a problem and a challenge. And that's where mask wearing is the #1 key, of course, with hygiene.
All right. Now, the issue of lockdown, you just mentioned it now. Many countries, in fact, most countries are easing out their restrictions gradually. In fact, the United States, that has the highest, that is the epicenter of COVID-19 now, is opening up gradually in many of the states. It's the same thing for the United Kingdom. It's the same thing for Nigeria, African countries, all across the world. But the point there is, talk to us basically, now that the numbers are still rising by the day, how do we reconcile the fact that everyone knows that the dangers are there, but restrictions are being eased while the numbers are still going up?
Then what you have to do there is to backpedal. You put your car in reverse gear, because if you can't move forward, because you know moving forward increases the danger, then you put your car in reverse gear and go backward. That means you may have to recount those easing procedure you are following. Then you may have to begin lockdown gradually. Just as you were moving forward gradually, you now stop and move backwards gradually and see what the situation is and adjust your movements to the situation.
Yeah, but how likely, when it comes to looking at it really practically, how likely is it that we can go back to the days of restriction, either partial, more restrictions, when governments are setting timetable and time frames to open the airspace, to open up states and all of that?
Well, it's a question of matching the situation with your action or your action with the situation. The areas where you have a greater surge, those are the areas you have to now begin to restrict and then begin to reopen in bits and pieces. You see, you have to match. Well, I mean, I know that the economy is of vital importance to people, but then health is just as vital, because without health, your economy is of little use. And without economy, your health can also be threatened. So it's a question of checks and balances. You have to weigh the two things at the same time, and then begin to adjust as the situation dictates.
Okay. All right. Let me ask you this question. I was asking one of my guests earlier on. At the beginning of this pandemic, there was the need to calm people down by ensuring they don't panic. And the statistics were rolled out. A fatality rate was below 3%, and everyone was told not to panic, no need for any anxiety, and all of that. Everyone relaxed, and now there's a complaint of people not following the health protocols because they feel that, contracting COVID-19 is not necessarily a death sentence. Talk to us about this.
Thank you very much. My pleasure joining you again. I think people misinterpreted that term, don't panic. Don't panic doesn't mean you should not take the necessary measures dictated by public health experts, the doctors, epidemiologists, virologists, immunologists, and so on and so forth. When they say don't panic, that means don't do things that could worsen things, because in a panic, you lose the oversight over the entire situation. Now that we don't have a medication against this specific virus, and we don't have a vaccine yet, and even when the vaccine comes, will it be affordable for people? And even the vaccine itself may not yield 100% protection, but the more that take the vaccine, the better. Even if we have a protection of 80, 90%, and majority of the population is given this vaccine, that would yield what is called herd immunity, so that the few that do not either take the vaccine or they do not produce the antibodies against it will at least be protected by the herd immunity. So the option we have now is to prevent. Since we don't have a medication, we don't have a vaccine, what you do is to prevent. Number one, masks, like I'm wearing now. 2, social distancing where it is possible. We must not lose sight of the hard fact that in our society, it's not only enclosures that where you're at risk, even outside, especially in our marketplaces, where you have thousands thrown together in very small, crowded areas. That is where you need this mask more than anything else. And then hygiene. Those are the 3 throngs.
All right.
Masks, hygiene, and social distancing.
And social distancing, all right, that's interesting. Now, WHO is saying that governments across the world will need to be a little more proactive than the way it is right now, because as the numbers are increasing so that the curve can be flattened, what more can governments do that they are not doing yet?
As I mentioned earlier, this question of easing the lockdown is a great idea because of the economy. Because some people are so entrenched and are so dependent on their being outside their homes to work. Otherwise, they can't earn anything. They can't feed their family. They can't provide for their families, and so on and so forth. So you have to weigh the options you have. And so you may have to self-pedal on this easing of lockdown. And then you have to adjust how much lockdown you can impose or reimpose if necessary, and identify areas where the upsurge is much higher and start there.
Okay. As it is right now, with the numbers increasing across countries, some, like in Nigeria, for instance, the isolation centers are running out of beds. In fact, the NCDC had come out to, has raised that alarm already that they are running out of beds. Now, what would it look like when the numbers of infected people and people who need the care and intensive attention or critical attention cannot find beds because all the beds are occupied? That phase, how challenging would it be and what can be done?
It will be very challenging. And this is one of the reasons why we should not focus on having sophisticated isolation centers. Okay. The important thing is that those who are positive in tests should then be put in places. I mean, you may have to build some new centers, halls, and so on and so forth, places where they can be isolated from the rest of the population so they don't circulate these viruses. That's it.
Well, it's quite interesting. We have to leave it here now. Thank you so much, Professor Ade Ojeniyi, for your time on the program this morning.